My name is Anne Jung and I'm from Spain. I'm a CTEPH patient and member of the National Association in Spain. After suffering several thrombotic episodes since the age of 19, I was diagnosed in 1997 with a rare bleeding disorder called hypodysfibrinogenemia. This is a combined defect that involves both low levels of fibrinogen and impaired function of the small amount of fibrinogen, and consequently little studied. The symptomatology varies by person. There are patients who suffer bleeding and others, like me, who have a thrombotic tendency. At 23, I had another thrombotic episode, an ictus, but without sequels. Since then, I have been followed up by hematology. In October 2010, I started to feel very bad, and with the slightest effort, my heart began to beat like mad, and I could not take 3 straight steps without getting tired. So I realized quickly that something was wrong, and I was very scared. After 24 hours in the emergency room and several tests, suddenly I was taken to the OY with a diagnosis of massive bilateral thromboembolism with a pneumonia in the right lung and with a pleural effusion. So with a treatment for the embolism, after 4 weeks in the hospital, I returned home, but I did not feel better. I still had the same symptoms as before my first admission. I felt very bad and very tired. Walking and less up the stairs was impossible, and I just wanted to lie on the couch. So I went to a cardiologist who, after an echo, confirmed me and sent me urgently to enter into the hospital again. Now, after passing new tests, they confirmed the diagnosis of pulmonary hypertension and rethrombosis on chronic thrombus. I had 60% of the main pulmonary arteries clogged, and my functional phase was at this moment 4. So when I heard that diagnosis, I was very sad and very confused. And now all was going on very, very quickly. The doctors told me about an operation that was going to save my life and in most cases up to healing, because the CTEPH is the only form of PH that is potentially curable. Now in March 2011, came the day of my surgery and luckily everything went well. And now 6 years later, after my surgery, I'm feeling much better and my functional class is 2. I think it's very important to have a quick diagnosis because PH is very difficult to diagnose. There is a diagnostic delay about 3 and 5 years. We must give the highest priority to the diagnosis. Since a person with this disease and without treatment has a shorter life expectancy, if the symptoms are not treated properly, it can lead to life-threatening. So it's very important. And after diagnosis, for example, in my case, I felt completely alone. I had never heard before talking about pulmonary hypertension. So newly diagnosed patients need advice and support. Other people do not understand you because a person with PH does not look sick. And so I was looking for a group with the same disease like me. And my doctor told me about the association where I found people who understand me because they have the same problems as me. At the moment, the association is my greatest support and formed by very, very special people and big fighters. They help support patients and their families. They inform and advise with psychology, a social work department. They give legal advice and, of course, invests for research. They are doing a very, very important labor for us. And they are also part of the PHA Europe. And I'm very glad to found all these wonderful people and say thanks to all because they are doing a really very great job. The association organized different awareness activities like sports events, inside, outside, galas, many other things, and is very proud of this event. The World Pulmonary Hypertension Day, May 5th, was hosted and organized this first celebration of the World PH Day, which was held in Spain in 2012. Since then, this date has been agreed by all patient associations, and different activities are celebrated worldwide at that day. So we have to raise awareness around the world. Together we are strong and make the disease known. We have to fight that everyone all over the world has access to the drugs. And now finally I want to say, I'm not completely cured, but I can do so many things that I could not do before and enjoy much more the small things in life. The scare on my chest makes me proud and gives me strength. I would like to transmit my positive energy and give encouragement and strength to all. Life is a gift that one should never give up, and we need a cure. My name is Jung, and I am aware that I am rare.